1 in 8 women will develop thyroid problems in their lifetime. And contrary to popular belief, men can get them as well. Your thyroid plays a vital part in regulating your metabolism. It produces hormones that are responsible for controlling how you respond to heat or cold, how your heart rate may increase or decrease, how much you burn calories, and much more. But when it produces too much or too little of these hormones, you can develop a number of diseases. On the program today, we'll talk more about this condition, how best to manage it, and ways to maintain a healthy thyroid. I'm Dr. Freddy Gomez, and welcome to MedTalk Health Talk on CNN Philippines. If you experience sudden weight gain or weight loss, there might be something wrong with your thyroid. Our guests are here today to tell us more about this. With us is Dr. Monica Kating Cabral, who is an endocrinologist from Asian Hospital and Medical Center. Also with us is Dr. Arjelin Ong, who is an ENT head and neck surgeon from the Medical City and co-founder of Celto Medico. Now, this topic, the thyroid, is very interesting because a lot of our viewers may be familiar with some of the disease entities but not so familiar on how a normal thyroid should be. Dr. Arj, saan ba nakikita ang thyroid natin? At normally, ito ba'y nakakapa?
Well, our thyroid gland is a butterfly-shaped gland that is found here at the front of the neck. So all of us have it. It's located here, somewhere below the Adam's apple. And normally, you will not be able to feel it, and it's not palpable or it's not noticeable in normal individuals.
Dr. Mitos, when it comes to function, ano ba yung role ng thyroid gland sa katawan ng isang tao?
The thyroid makes thyroid hormone, and this is the hormone that controls our metabolism. So if you have a lack of thyroid hormone or kulang ka sa thyroid hormone, this is called hypothyroidism, and your metabolism can be slow. So patients tend to gain weight, they feel cold, they're constipated. So that's the usual person who is lacking thyroid hormone. Kung sobra naman tayo sa thyroid hormone, parang napakabilis ng metabolism. So everything is fast. Your heart rate is fast, you have palpitations, pinagpapawisan, tremors, and then patients also tend to lose weight.
Now let's talk about goiter, or in Tagalog, bosyo. Normally, this is very common in the Philippines, especially in certain areas. Dr. Mitos, bakit kaya this is the case, na this is common in certain areas of the Philippines as opposed to others?
Before, actually, this was very common in the areas like the mountain provinces, way up in the mountains where we don't get seafood. So what's important about that? The main ingredient kasi, yung pinakasangkap ng thyroid hormone is iodine. And iodine comes from seafood. Kung kulang ka sa iodine sa diet, ang mangyayari dyan, your thyroid wants to make a lot of thyroid hormone. Kung kulang siya sa iodine, then it tries to compensate for that. No? So nagiging overactive yung mga cells sa thyroid natin. And that's when you can develop nodules or enlargements in the thyroid.
Now, Dr. Arj, pag nagkaroon ng goiter, meron ng lumaki, automatic, a lot of our viewers might think pag merong lumaki na bagay sa katawan, cancer na ito. Is this usually the case?
One type of enlargement of the thyroid or goiter is what we call nodular goiter. So, ibig sabihin, yung thyroid gland natin, nagpo-form siya ng mga nodules, and these nodules are usually divided into benign or yung malignant or cancerous. And studies show that majority pa rin ng nodules sa thyroid are still benign.
And another thing also, Dr. Arj, many think na yung panlalaki sa due ito sa excessive talking, malakas sa pagsigaw o madalas na pagkakanta. Is there any truth to this?
So no, that's not true. Kahit gaano kalakas ka sumigaw, kahit gaano kadaldal ka, it will not cause an enlargement of your thyroid gland.
Now, while pregnancy is a risk factor for having goiter, some believe that it can be passed down from mother to the child or to the baby. Dr. Mitos, ang goiter ba ay namamana ba ito?
So yung goiter, pwedeng namamana siya. So, pero hindi naman ibig sabihin kung may goiter yung nanay mo, habang nasa loob ka pa rin ng nanay mo na magkaka-goiter ka din. Yung nakakatakot lang po is kung hyperthyroid yung nanay at sobra po ang thyroid hormone niya habang buntis, yun pwede pong apektado yung baby bago pa siyang lumabas. But just because you had a thyroid nodule doesn't mean that all your children will have it. There is a risk kung nagkaroon po ng nodule that is cancerous. There are certain types of thyroid cancer that can run in families. No? So that's the one thing that we have to identify. Kailangan po malaman kung may bukol po tayo sa thyroid, ano kaya yung dahilan.
Now, let's talk about nodules at this point, Dr. Mitos, because this is something that's very important, one that may signify that there is some abnormality here. If someone has a nodule, ito ba ay nakakapa? And if so, should they worry about this? Are nodules in the body something that our viewers should worry about?
These nodules are usually benign. Now, the nodules can be solid or they can actually just be cyst. So, kapag kinakapa niyo po yung leg ninyo at parang may nakikita kayong bukol dyan, kahit nakikita rin minsan po sa salamin, hindi pa natin alam kung solid yan, kung full of fluid or cyst lang po siya. So, yun po muna kailangan nating malaman. But again, most nodules, lumalaki ba sila na mabilis? Yun din yung isang kailangan bantayan.
Reminder to our viewers, don't be alarmed right away. Have it checked with your doctor, with your endocrinologist, or your surgeon, for that matter, to be able to be sure if, and they will perform some tests, whether to find out if that nodule is something to worry about or not. Anyone can develop a goiter, but there are some who are more vulnerable to it. And there are also a number of factors that can influence your thyroid function or its growth. More on this when we return. You're watching MedTalk Health Talk, your partner in healthcare. I'm Dr. Freddy Gomez, and welcome back to MedTalk Health Talk, where caring is our calling. Now, your thyroid is a small, butterfly-shaped organ responsible for regulating your metabolism, but when it's swollen or enlarged, you might have a problem called goiter. Now, it's important to note that it doesn't necessarily indicate that your thyroid is malfunctioning, but it does mean that there's a condition present that's causing it to grow abnormally. Now, I'd like to talk about the other side of the thyroid problems, and that is a malignancy or cancer na ng thyroid. Why is this so kaya? Bakit tinatawag itong good cancer?
So there are many types of thyroid cancers, but ang pinaka-common po ang tinatawag na papillary thyroid cancer. And it's oftentimes termed as a good type of cancer because it is very slow growing. And because of that, surgery is the best form of treatment because when caught early and treated properly, then the cure rate is very, very high. And the patient can continue to live a normal life after treatment.
So the prognosis is really good, especially pag nakuha ito ng maaga. Dr. Mitos, when it comes to some of the symptoms na nangyayari for someone with thyroid cancer as opposed to goiter, mas evident ba ang isang thyroid that is malignant or cancerous?
Hindi rin. No? So that's why it's really important to try and find out what the diagnosis is. We do the biopsy to find out if it's cancer. Nag-mention si Dr. Arch na if it's fast-growing, we usually do recommend surgery already. The good thing about the most common type of thyroid cancer, yung tinatawag na papillary thyroid cancer, as she mentioned, it's slow to grow. It's also slow to metastasize. So yun ang takot natin, di ba? Pag sinabi mo yung cancer, kumalat ba siya? So with papillary thyroid cancer, it's also slow to metastasize. And there's medication actually that we can give after surgery to try and make sure that the metastasis is very minimal or that we catch the metastasis early or that we also can prevent metastasis from occurring after surgery.
Earlier on the show, I mentioned how women are more likely to have a problem with the thyroid gland, but men are at risk as well. What should men know about this? Or what are the statistics with men having a thyroid problem?
Both men and women can have a lack or an excess of thyroid hormone, yung sobra or yung kulang. But what's more concerning in men is when they have thyroid nodules. It's been shown that men, especially younger men in 20s and 30s, Kung may goiter po sila, may bukol dyan. These usually are biopsied early. We follow them with ultrasound more frequently, like every 6 months. And if it's seen that they're enlarging rapidly, and definitely if on biopsy nakita po na cancer siya, dapat kailangan po surgical removal already of the thyroid.
Dr. Arch, when it comes to risk factors for thyroid cancer, what would be the more common ones?
Well, some of the risk factors that have been seen to develop thyroid cancer would be first is specific type of radiation. If you were exposed to radiation as a child, then you are at risk to develop thyroid cancers. As Dr. Mitos mentioned a while ago, some thyroid cancers can run in families. So we have several patients that have had family members all with thyroid cancers. And another thing is, as with other cancers, as you get older, you're more prone to develop some cancer. So advanced age can also be a risk factor.
Now, Dr. Mitos, for someone who is diagnosed with a thyroid cancer and may not be ready for surgery for one reason or another, nakukuha ba ito? Is this treatable with medicine alone?
Unfortunately, it's not. No, it's really surgical removal of the thyroid that will help bring about that cure. It's caught early. The chances of you being alive in the next 10 years is actually very high, 90+%. Some even say close to 100%. So if you have a thyroid nodule that looks suspicious for cancer or is confirmed to be cancer, please have it removed. Now, this is the most important part, really, because we cannot continue with the other medications or therapies after you get diagnosed with thyroid cancer if the thyroid is still there.
Now, Dr. Arch, I'd like to ask, earlier you mentioned how the thyroid gland looks like a butterfly. Its wings being each lobe, so the thyroid has 2 lobes. Kapag ang isang pakpak lang o isang lobe lang ng thyroid ang malignant, ang may cancer, kailangan ba tanggalin yung buong thyroid gland or pwedeng yung parte lang, yung portion lang na may cancer?
Really depends on the size of the nodule and the size of the cancer present in the thyroid. Recent studies have shown that sometimes only one side can be removed if the cancer is caught early and the nodule is small. But in majority of cases, if medyo malaki na po yung nodule, then we will have to remove the entire thyroid gland so that the endocrinologist can give the additional treatment after the surgery.
Now, Dr. Mitos, you mentioned earlier how important our thyroid gland is. Pero kapag ito ay meron ng cancer at kailangan ng tanggalin ng buo, can the body function normally without a thyroid gland?
So we cannot function without thyroid hormone. And unfortunately, it's only the thyroid gland that can make thyroid hormone. The good thing is, though, after you get your thyroid taken out after surgery for thyroid cancer, we can replace thyroid hormone with tablets. And these tablets are very small. You just have to take them once a day, but you have to take them for the rest of your life. So please do not forget to take your thyroid hormone because your metabolism, like I said, it depends on your thyroid hormone. If you don't have it, everything will become slow. You will gain weight. You will become very sleepy. You feel cold all the time. And patients in very severe cases, kung kulang na kulang po talaga sila sa thyroid hormone, they can fall into a coma. So we have medication available. It just has to be adjusted from time to time. You will see your doctor and they will do some tests. We check something called the thyroid stimulating hormone, TSH. That might sound familiar to some of our viewers. And that is how we adjust the medication. But it's something that you have to take for life.
With advancements in medical treatment and diagnosis, thyroid problems, no matter what it is, there is an option for that. We'll find out later how to diagnose and what are the options available today. Stay with us here on MedTalk Health Talk. We'll be right back. I'm Dr. Freddy Gomez, and this is MedTalk Health Talk, your partner in healthcare. So we've been talking about the thyroid and how a lot of the problems with the thyroid, merong solusyon po para sa mga ito. Now let's talk about how to determine or how to diagnose na meron tayong problema sa thyroid. Dr. Mitos, what is the most simple and most cost-effective test that is done for the thyroid that can yield a good amount of information for the doctor?
So the best screening test that we do for thyroid function is the TSH, the thyroid stimulating hormone. So when TSH is high, we sometimes think about hypothyroidism. When it is low, we think about hyperthyroidism. So if we're screening somebody for a thyroid problem, we just use a TSH.
Now, Dr. Arj, let's talk about the biopsy. Many people are hesitant when they hear the word that they need a biopsy on their thyroid gland. How important is this? And is this something that the patient can do without?
So usually, pag ang isang patient may nakakapa siyang nodule, the doctor will request for an ultrasound. So the first step in doing a biopsy of the nodule is to do a fine needle aspiration biopsy. And many times it is done ultrasound guided so that you can get an accurate sample. So the needle that is used during a biopsy is very thin, very, very similar to the needles used for vaccines. So it's an outpatient procedure. It's done in the clinic with very minimal pain. But the information that it provides the doctors and the patients is very, very valuable. And most of the time, it is really necessary to be able to determine the next step that's best for the patient.
Now, Dr. Arch, when it comes to lifestyle naman, yan ang gusto natin, how to prevent it? This is what we want to know. Are there any lifestyle changes that should be followed in order to have a healthy thyroid?
One of the important factors in thyroid diseases is really iodine. The use of iodized salt has really helped a lot in preventing some of our thyroid diseases. And in general, living a healthy lifestyle, not smoking, moderate alcohol intake, will make you healthy overall.
Dr. Mitos, there's been some recent studies on some links between obesity and thyroid cancer. Could you talk a little bit more about this?
In general, obesity has a relationship with a lot of cancers, not just thyroid cancer. And it's also because of the alterations of hormones within the body. There can also be alterations in a woman's life, for example. That's why you mentioned earlier in the program that women tend to have thyroid cancer more than men. And this is also because of the hormonal changes that occur during menstrual periods or during menopause. So in order to maintain really a healthy lifestyle, and to maintain a healthy thyroid, it's really maintaining a healthy weight, eating properly. Some though might tend to think, okay, if I have a goiter, maybe I should eat more seafood. Let's just be careful about that, especially if you're not sure if you are hyperthyroid or not. Because like I said, iodine is the main ingredient in thyroid hormone. And if you eat too much seafood, you could be making actually more thyroid hormone. So if you have those symptoms of hyperthyroidism, palpitations, sweats, unexplained weight loss, please see your endocrinologist so that you can get tested properly for your thyroid hormones.
Before we go, Dr. Arj, do you have any parting words or advice for our viewers when it comes to their thyroid?
Yeah, so for our viewers and for everyone watching, if you ever feel something sa leeg niyo po, kung may nakapa kayo, go see your doctor right away. Because as mentioned a while ago, nodules, whether benign or malignant, once caught early, if the diagnosis is done at a prompt time, then the disease is very curable and you'll be able to live a normal life after.
Now, Dr. Mitos, any final words from you?
Huwag pong matakot uminom ng malamig na tubig, pwede pong kumanta, pwede pong maging madaldal, pwede magbuhat ng mabibigat. Di po ito magiging sanhi ng bosyo o goiter. And if you're concerned po about your thyroid function, please go see your endocrinologist. We can do a very simple blood test to find out if you need thyroid hormone replacement or if you need to control the amount of thyroid hormone that you make.
While it's a common condition, those living with goiter or any thyroid disease can go on to live normal lives. All you need is proper management and treatment. Thank you, endocrinologist Dr. Monica Kating Cabral and ENT head and neck surgeon Dr. Arjelin Ong for being with us today and sharing your time and your insights. I'm Dr. Freddy Gomez and thank you for watching MedTalk Health Talk on CNN Philippines. We'll see you again next time.